Okay, back to the eye. So we're talking about the eyelids. Now let's talk about the eye itself and the gross anatomy. So you probably know what this is, and we talked about this when we covered the autonomic nervous system. This is your pupil, that black dot in the middle of your eye. But your pupil is not a solid structure, and we'll get to why later. It's actually a hole in the middle of your iris. So the colored part of your eye, a lot of people have brown eyes, there you may have blue, green, gray, but that colored part in the center of your eye, that's your iris. So this part, and this actually person, maybe hazel eyes, they have multiple colors, pretty cool. But the white of your eye, and it has all these blood vessels as well, but the whitish part compared to the iris is what you call the sclera. So again, the iris is that central colored part, but everything around that, that's the sclera and its own layer as well. And let's zoom in on the pupil. And what we have here is, again, the pupil, or in the pupil and the iris. So again, that hole. So you notice that this pupil is a hole in the middle of the iris. So this black part right there, that's the pupil. And surrounding it is that iris. And I know it's very interesting seeing all those like fibers and proteins and structures of the iris as well. Now, the sclera, this part, the white of your eye is the sclera, and notice that it's very vascular, and all the proteins and all the nutrients that are supplied by that also helps contribute to the sclera is a very fibrous, protein-rich area, so this is why it's not clear, and this is why it looks opaque, so this is why it's whitish and you can't see past it. Now, over here, now there's another structure. We talked about the pupil, we talked about the iris, we talked about the sclera. But in this part, there's another structure that's there, but you can't really see it. So what we have here is a side view. And what's the part causing the shine over here? So surrounding and outer to your, or not surrounding, but just outer and more anterior to your iris and pupil, you have this layer called the cornea. So notice that the cornea is continuous with the sclera, but what's one big difference? The sclera is opaque and whitish, and the cornea should be, in a healthy cornea, is clear. And you want it to be clear because why? For vision, you have light entering your eye, going past the pupils, so you don't want that light being filtered out. You want that cornea to be clear. And notice that the cornea is slightly curved, and this is where we'll get to in very soon. Like the curved part is actually very important. But again, we're just talking about gross anatomy right now, and here are two angles. Yeah, like back to geometry. These are angles, and which one is me? So this is the right eye we're looking at. So the one that's more inner toward the midline, that's our medial angle, and there's actually multiple terms for this. Medial angle, medial canthus, medial commissure. This is referring to the same structure, just like the inner angle of your eye. And what's the opposite of medial? Lateral, right? So the lateral angle and okay, lateral canthus or lateral commissure. So you have two angles, and again, it just depends, is it closer toward the inside and your midline, or is it toward the outside and lateral?